lesser curvature of the stomach. Look, lesser curvature of the stomach is present on the right side, not on the left side. Right adrenal vein directly drains into the inferior vena cava, as inferior vena cava is located on the right side, but the left one cannot reach so long distance. For the urinary bladder and prostate, the basins of bladder and prostate just join to form a basico-prostatic venous plexus. Now about the gallbladder. So we know the blood supply of gallbladder is the cystic artery. Cystic artery is a branch of the right hepatic artery and it is located in the callous triangle. And the boundary of callous triangle is the superior border is formed by the inferior aspect of the liver, inferior border of the liver, and inferiorly the cystic duct and medially the right hepatic duct. So it is the inferior border of the liver, cystic duct inferiorly and medially the right hepatic duct, and the content cystic artery and the cystic lymph node of Lund. Okay, cystic lymph node of Lund. So which of the following vessels mainly responsible for blood supply to the bile duct? Okay, so the main supply, Whipple's procedure for carcinoma head of the pancreas, bile duct is transected. So main supply for the bile duct comes from the hepatic artery, but it the bile duct gets its blood supply from a number of sources from the, but main branches are the retroduodenal branches of the gastroduodenal artery. So the gastroduodenal artery comes from the hepatic artery. In that sense, it has been mentioned the branches of hepatic artery, but cystic artery can give branches, other pancreatic branches can give branches, some duodenal branches may provide blood supply. But the main supply, okay, the bile duct has an axial blood supply which is derived from the hepatic artery and from the retroduodenal branches of the gastroduodenal artery. Excitedly embark on your first laparoscopic cholecystectomy, and during the operation the anatomy of the callous triangle is more hostile than anticipated. Whilst trying to apply a hemostatic clip, you avulse the cystic artery. This, which source is this most likely to originate? Cystic artery comes from the right hepatic artery. So which of the following statements relating to the gallbladder is untrue? The fundus is usually intraperitoneal. Exactly. Arterial supply from cystic artery located in the callous triangle may rarely contain an aberrant hepatic artery. It is also true. Cholecystokinin causes relaxation of the gallbladder. Now we know about the cholecystokinin. Cholecysto means gallbladder, kinesis means movement, that is contraction. So from the name you can deduct what its function is. So cholecystokinin causes relaxation of pancreas. Its original name is cholecystokinin pancreozymin. So it causes contraction of the gallbladder as well as release of enzyme rich ecbolic type of secretion of pancreas. Two major functions. So next it is the pancreas. So pancreas we know it is the retroperitoneal organ and posterior to the stomach, and its important relations are basically one with the pancreatic head, that is the common bile duct behind inferior vena cava, and superior mesenteric vein and artery, and behind, and the pancreatic neck, superior mesenteric vein, formation of the portal vein, and body of the pancreas, that is adrenal gland, kidney and aorta behind the body of the pancreas. Okay, and from the pancreatic tail, the spleen is related with the pancreatic tail, and during splenectomy the pancreatic tail might get injured, resulting in a pancreatic fistula. These are the posterior relation and then anterior relation. Anterior to the uncinate process, we know anterior to the uncinate process lies the superior mesenteric artery and vein. Okay. So arterial supply from the head, from the superior inferior pancreaticoduodenal artery. Superior pancreaticoduodenal artery comes from the gastroduodenal artery, inferior comes from the superior mesenteric artery. Rest of the pancreas is supplied by the branches of splenic artery. Now the question: 53 years old man is undergoing a distal pancreatectomy for trauma. Which of the following vessels is responsible for the arterial supply to the tail of the pancreas? So it is basically splenic artery that passes over the body of the pancreas. So look, suppose this is the pancreas, this is the splenic artery and gives branch to the pancreatic body and tail, and this is the superior pancreaticoduodenal, inferior pancreaticoduodenal from the superior mesenteric artery, and this from the gastroduodenal artery. So at the region of head by these two pancreatic adrenal artery, and the rest are supplied by the branches of splenic artery. 56 years old man undergoing pancreatectomy for carcinoma, resection of the gland. Which of the following structures will the surgeon not encounter posterior to the pancreas itself? Left crus posteriorly, superior mesenteric vein maybe posteriorly, common bile duct, portal vein. Gastroduodenal artery, there is no relation of the gastroduodenal artery posterior to the pancreas. Okay, gastroduodenal artery, it is related posterior to the first part of duodenum. 60 years old female is undergoing a Whipple's procedure for adenocarcinoma pancreas. As the surgeons begin to mobilize the pancreatic head, they identify a large vessel passing inferiorly over the anterior aspect of uncinate process. So, suppose this is the aorta and this is the uncinate process, and this is the superior mesenteric artery and veins passing just anterior to the uncinate process. So, that will be superior mesenteric artery. During embryological development, which of the following represent the correct origin of the pancreas? We know that pancreas arises from the dorsal and ventral bud, pancreatic bud. Those are the outgrowth of the foregut and midgut. So, dorsal and ventral endodermal outgrowth of the duodenum. Now, the spleen. So, we will directly move to the question and then analyze, because not all the discussion is needed. Which of the following statements about the spleen is false? The hilum contains the splenic vessels, exactly, and these splenic vessels are contained within the linorenal ligament. This is the main ligament. Okay. So, this linorenal ligament, it is the most posterior structure at the hilum, but it contains the hilar structures as well as the tail of the pancreas. Spleen is derived from the endodermal tissue. No, it is derived from the mesodermal tissue, mesoderm of the dorsal mesogastrium, mesoderm of dorsal mesogastrium. Initially, there was two mesogastrium, ventral and dorsal. This dorsal mesogastrium gives rise to spleen, greater omentum, this linorenal ligament, etc. Whereas the ventral mesogastrium gives rise to the lesser omentum. So, this develops from the mesoderm, and more specifically the splanchnopluric layer of lateral plate mesoderm. White pulp has immune function because there is B cells, colon lies inferiorly, exactly. Okay. Now, what are the positions of the accessory spleens? There are number of positions for the accessory spleens or spleniculi. This is known as the spleniculi. So, location at the hilum of the spleen, tail of the pancreas, along the splenic vessels, in the gastrosplenic ligament, linorenal ligament, wall of the stomach intestines, but greater omentum, mesentery, and even the gonads can be the sites for ectopic spleens or accessory spleens. An enthusiastic surgical registrar undertakes first solo splenectomy. The operation is far more difficult than anticipated. The